Have you ever had a lack of confidence in telling your patients what your best recommendations would be for their care? In essence, your best recommendations for their best results. I was just speaking with a doctor about this and I thought I would share the discussion that we had as it may be of value to you. By the way, I'm Dr. Russ Rosen. I help natural healthcare providers like you thrive in a care versus care true optimal health model. So here's the deal. In this particular case, this doctor and I have been through how do you come up with a good care plan? How do you come up with your recommendations for what the patient wants in your office? How do you monitor the patient's response to care so you know that they're improving and they're moving along as you would hope? What do you do if they're not moving along as you would hope for or as you would expect? Like we've already been through all of that. So in our report of findings, one of the things that we do right before we get to showing them the real numbers, how many visits, how much it costs, is we do a verbal review. Cover lots of points, but one of 5 points that we cover very quickly is this. We talk about on the path to optimal health, -10 is near death, 0 is comfort, and +10 is optimal health. Okay, 0, you're feeling good, but you're not functioning at your optimum. Your tests would not be clear, the ones we just went through. Here, you'd be at optimal health. We know you're not just feeling great, but you're functioning at your optimum, and the tests are clear. So they just told you what they want. I want to get to optimal health. Okay, great. So now we need to come up with a plan to get there. So in our verbal review, we say, I'm going to recommend about this many visits over this period of time. And here's what you should expect subjectively. Here's how you should feel. And this is what you should expect objectively. Okay. We then say, and at that point, we're going to do a reevaluation and we will really clarify if they're moving in the right direction or not, etc. And then, assuming they're doing well, it would most likely look like this. We would do this many visits over this period of time. And here's what you would expect subjectively and then objectively. And then we would do another reevaluation and report our findings to you to make sure that you're moving along as we would expect. And then it would look like this. So we're very clear about what our expectations are. And we let them know that if for some reason you're not moving along as expected, here's what we're going to do about it. So either you need to do something different, eat better, exercise, deal with stress, make your appointments, which we've already talked to them about. I need to do something different, see you more often, different technique, etc. We need to do something different, or I need to refer you out. But we're not going to just keep doing the same thing and praying for a different response. Okay. So that's something, excuse me, that we do with our patients. We're very, very clear about this is what we're going to do over this period of time. This is what we expect to see. We'll do a reevaluation right? At that time, we'll either do this, but if you're not moving along, here's what we're going to do about it. So, and this doctor was really good at that. I've listened to live interactions, really good at it. So I said, are you having confidence issues telling your patient the truth about how much care they need? And he said, yes. And I said, so let me ask you this. Are you telling your patients in the verbal review, I'm going to recommend about this many visits over this period of time. Here's what you can expect subjectively and objectively. We'll do a reevaluation. Assuming you're doing well, we'll do this. And if not, we'll do that. Are you doing that or has that dropped out? And he thought about it and he said, it's dropped out. I realize I've not been doing that. And I said, okay, so just think about this through that lens. If you were telling them that, I'm going to recommend this many visits over this period of time. Here's what you can expect. If not, here's what we're going to do. Through that lens, would you then feel comfortable just telling them the truth about what they need? And he thought about it and he laughed and he said, yes. So the truth of the matter is if we're doing it the right way, if we're telling the truth, the whole truth and nothing but the truth, we can be very confident in simply telling them the truth. The reality is when we're not honest, when we're not clear, when we're not telling the whole truth, it doesn't feel good. It doesn't feel right. It doesn't feel clean. And of course, it affects our confidence. So my recommendation is one, get really good at being clear with your patients about the truth of what they need. Learn how to communicate it in a way that works for them. And then just tell the truth, the whole truth, with absolutely no charge. If they just want to feel better, far out. If they want to get healthy and stay healthy, far out. That's between them and their creator. Your job is to help them understand what you can do for them. One of the things we always talk about is find out what they want in relationship to what you can truly do for them and show them how to have it. If they just want to feel better, far out. If they want to get healthy and stay healthy, far out. It's their choice. It's then your responsibility to tell them the truth. So if you have any questions about this, go ahead and post below. If you got this via email, just flip me an email. I will respond. If you know other people who you think could find value from this, would you do me a favor and share it with them? If you would like to thrive in a care versus care true optimal health model, if you want to help your patients get healthy and stay healthy versus just getting out of pain, let me know. Let's set up a time. Let's talk. Let's get clear about where you're at, where you want to get to, and how we might be able to help you get there. I hope you found value. As always, much love and aloha. Bye, gang.